Parkinson's disease. It's a progressive degeneration of the dopaminergic neurons present within the substantia nigra, which leads to the tremor-like symptoms. Primary etiology appears to be the accumulation of alpha-S-nuclein protein in various parts of the brain, primarily the substantia nigra. So as you see, the accumulation of the alpha-S-nuclein in the substantia nigra. The accumulation of the alpha-S-nuclein protein may be secondary to a genetic predisposition, which could be triggered by an unknown environmental agent, namely pesticides and herbicides. Being one of the most common neurodegenerative disorders, with a prevalence increasing with age, it affects about 1% of the people over the age of 60, and the prevalence increases to around 4 to 5% in those over 85. The incidence of Parkinson's disease also increases with age, but it can affect people of all ages, including younger adults. And the incidence is estimated to be around 15 to 20 per 100,000 persons in every year in the general population. From a gender perspective, Parkinson's disease primarily targets male genders compared to female genders.
There is no cure for Parkinson's disease, but the therapy includes medicine, surgery, and rehabilitation can reduce symptoms. The most common drugs for treatment of Parkinson's disease are levodopa, dopamine agonist, and monoaminoxidase inhibitors. Levodopa is a medicine that increases amounts of dopamine in the brain, in the most common medicine for Parkinson's disease. Deep brain stimulation and other therapy can help the tremors and reduce the needs for medicines. Rehabilitation includes physiotherapy, can offer relief for Parkinson's disorders, can others degenerative neurological disorders. The therapy includes stretch training, gait and balance training, and hydrotherapy. This therapy can help improve functions and quality of life for people with Parkinson's disorders. This can help also reduce the strain on care.
Parkinson's disease symptoms can be different for everyone. Early symptoms may be mild and go unnoticed. Symptoms often begin on the side of the body, they usually the main words on that side, even after symptoms begin to affect the limbs of the both sides. Symptoms include tremor, bradykinesia, rigid muscles, loss of automatic movements, speech changes, writing changes. Tremor, rhythmic shaking called tremor, usually begins in the limb over your hand or fingers. You may rub your thumb and forefinger back and forth. This is known as a pill-rolling tremor. Your hand may tremble when it's at rest. The shaking may decrease when you are performing tasks. Bradykinesia. Over time, Parkinson's disease may slow your movement, making simple tasks difficult and time-consuming. Your steps may become shorter when you walk. It may be difficult to get out of the chair. You may drag or shuffle your feet as you try to walk. Rigid muscles. Muscle stiffness may occur in any part of your body. Your stiff muscles can be painful and limit your range of motion. Impaired posture and balance. Your posture may become stooped, or you may fall or have balance problems as a result of Parkinson's disease. Loss of automatic movements. You may have a decreased ability to perform unconscious movements, include blinking, smiling, or swirling your arms when you walk. Speech changes. You may speak softly or quickly, slur or hesitate before talking. Your speech may be more monotone rather than have the usual speech patterns. Writing changes. It may become hard to write, and your writing may appear small.